Grilled with fire. Perfectly smoky. Rich, juicy, and chewy texture. Ribs. Inside shell. Gelatinous and savory lobster. The more you chew, the deeper the taste. Nutritious squid. Parboiled octopus. Golden appearance. Collagen-rich pig's feet. When you are hungry. For your health. Delicious food everywhere in the world. But you cannot eat. You have implants. We recommend just for you. Duplo. Bad pain. Bad mouth smell. How expensive was the cost? Duplo implant. Duplo implant from Isenkoria is a new concept implant totally different from conventional implants. Because with our reamer-driven low-speed drilling method, the patient's bone can be taken for autologous bone graft. It is economical, and wedge-type connection method relieves the concerns about side effects caused by bacterial penetration. You are in good hands with Duplo implant. Duplo implant. Shall we take a closer look at how it is different?
Perform infiltration anesthesia or block anesthesia. Make an incision using blade or flap, open after horizontal vertical incision, or try an incision flap opening using the tissue punch. After placing the selected stopper on the pilot drill and mark it on the region to be placed, identify precisely where the fixture will be placed. Use pilot drill in a full-depth pumping method until the stopper reaches the upper side of alveolar crest. Verify the gap in orientation between the teeth by initially placing paralleling pins into the hole formed in the bone. Use the depth gauge to check if the drilling has been done to the correct depth. If the hole is not formed in the correct direction, use the Linderman drill to correct the direction. After reaming, collect the bone harvested in reamer in titanium bowls. In the final reaming phase, pumping reaming is performed 3 to 4 times so that the bone chips that potentially exist inside the hole are completely removed. There are 2 methods of fixing. The way you see now is a 2-stage implant. Remove the plastic healing plug. Connect the implant seating tip to the handle and place it after tapping. And then, cut the plastic healing plug to the crestal level using a cutter. Fill the remaining space with the harvested bone when reaming and suture. Next, indirect methods is to connect impression posts to the same size to the placed fixture and take the rubber impression after connecting the plastic sleeve included in the impression post. Then connect impression post to plastic sleeve buried in rubber impression, and then create master stone model by connecting implant analog. After, select the abutment and attach it to the master stone model, considering the relationship between the antagonistic teeth and adjacent teeth, and make the final restoration through wax-up work. Crown setting includes intraoral setting and extraoral setting. First, intraoral setting is a method of applying a dental cement inside the final prosthesis produced, and then combining it into the abutment mounted inside the mouth, and then completely removing the cement which has hardened after flowing out of the margin. Extraoral setting is a method of applying a dental cement inside the final prosthesis produced, and then combining it into the abutment selected outside the mouth, and then completely removing the cement which has hardened after flowing out of the margin. Then, the combined prosthesis is selected in the most appropriate direction, considering the relationship with antagonistic teeth and the adjacent abutment, and then make a first connection with the abutment using crown forceps.
If you are considering about implants as there is less pain and swelling, Duplo. We recommend Duplo implant from Isenkoria.